Hi, my name is Dillon Powell. I'm a second-year medical student at the University of Kentucky College of Medicine, Northern Kentucky campus. The reason I really wanted to be a doctor was the fact that I saw there were disparities in how people got treatment, specifically referring to my aunt. I don't believe that my aunt trusted her doctors, and unfortunately that led to her having a heart attack and passing away in our living room. My aunt didn't receive the treatment that she deserved, and for me, I knew there was a role I could play in helping to ensure that everybody got the care that they truly deserved. To describe my studies, right now we are studying the respiratory system, so all about your lungs. When I was in high school, I would start about 8 a.m., would get out about 2:30, and that's typically what I stick with now. 5 days of the week, we will have book work, which is just normal studying. We also learn to interview patients. When we role play, what it's like to go to the doctor. So we practice our physical exam skills, our interview skills, and it allows us a safe place to be wrong. One of my favorite things about being a medical student has definitely been meeting the people. We're all going through the grind together, and it's been amazing to meet some of the smartest people I've ever met in my life. The reality is that I can't hang out with my friends all the time as much as I want to. I see my friends out there enjoying life, making money, and I'm here studying. During the week, I can't take a day off without having to face the repercussions of not studying that day because that material doesn't go away. So the grind of medical school is definitely the hardest part about it. What keeps me going is the constant reminder of why I came here in the first place. My aspirations are to be a sports med physician. The reason I got interested in sports medicine is because I've played sports my entire life. So I started playing football when I was 7 years old, played all the way through middle school, high school, and then even played 3 years in college. Playing football all these years, it definitely came with its injuries. I've sprained my MCL twice, I've torn my meniscus, I've pulled my hamstring twice, I've pulled my quad, and then I've had plenty of ankle sprains over the years. And just seeing the injuries and seeing how the doctor played the key role in getting that person back out there just really stuck with me. In a lot of ways, sports medicine just attaches me back to my roots and who I am as a person. Growing up African American as well as poor, there was this sense that you didn't go to the doctor unless you were really, really sick. I think as a doctor, what I want to do differently is show my patients that I truly care, that I understand that there's things going on outside that maybe we just need to talk about. Trying to understand where you're at in your life and what the ramifications of the actions that are happening right now will have on your life in 5 years, in 10 years, in 20 years. In terms of growing up poor, I think the beauty of it was the fact that I didn't know that we were. I didn't understand why, until later in my life, that we ate hot dogs multiple days a week. Why I didn't get brand new football cleats all the time, why they always seemed broken in. For me, I don't think that being poor was an obstacle at all, because my parents instilled in me that I was going to be better than this. I wasn't going to be struggling the way that they struggled. I was going to college regardless if I wanted to or not. I went to Simon Kenton, graduated in 2016. When I was there, our football team was really good, so it was a lot of fun, especially Fridays. Growing up in the area, it's been really nice to stay connected with the guys that I really did grow up with. I went to undergrad at Thomas More University right here in Crestview Hills. We had to take a big test called the MCAT, which you take after your junior year in undergrad. And that test is a hard test. It's over your first 3 years, pretty much your entire biology degree. And it's the preliminary test to get into medical school. So if you don't do well on it, the chances of you getting in are much lower. I will say I didn't do fantastic on it, but I communicate well. So I interviewed well, which got me to this point. When I'm not studying, I hang out with my dog, hang out with my wife. We like to be outdoors. Sports definitely helped. It was an escape, but it opened a lot of doors that maybe wouldn't have been open if I didn't play sports. And being the outlet that I needed them to be, they made me grow as a person. I learned a lot of my leadership skills out there on the football field, and football allowed me to be and flourish as the leader that I was. When you break it down, medicine really is a team sport. We're working towards one common goal. We need leaders on the team. We need everybody to play their role. I'm a very outgoing person who likes to be loud and be the most heard, but a lot of my classmates are the ones that sit in the back and just do their thing. I think the beauty of medicine is the fact that there are so many different personalities that pursue it. Be you. Don't try to be anybody different. Work at what you're good at. Work at what you're not good at. Just work. Just be the student you are, be the athlete you are. Just be you. My name is Dillon Powell. I'm a UK College of Medicine student.